container has circled the world many times over, carrying everything from playground equipment to pesticides. But today, it's being filled with a different type of cargo: hope. Hope in the form of life-saving medical equipment, ranging from a patient's recovery room to an entire hospital, complete with everything from a wholly functional operating room to medical libraries and administrative offices. Everything needed to protect and preserve life in some of the world's most challenging locales. These are the volunteers of IMEC, the International Medical Equipment Collaborative, a uniquely successful organization dedicated to helping those trained to help others.
Well, I was at an installation visit in the Pumwani Medical Center, the maternity hospital, where I arrived sometime after the equipment had been there, and I had seen it before and after. And before, there were, 2 or 3 patients in each bed, 4 babies in each incubator, people on the floor on mattresses. They were reusing gloves. It was really incredible. And then afterwards, there was clean sheets and mattresses on every bed, 1 patient in each bed, 1 baby in each incubator, and the staff was much happier, the patients were much happier, and the level of care was vastly improved just because of what IMEC sent in 1 container. And you can imagine what it's like when we send several containers to these places. I gave up my very busy medical practice a few years ago, and I now volunteer pretty much full-time at IMEC, and I feel like the work I do here is probably as important, if not more important, than being a practicing physician.
Since its founding in 1995, IMEC has identified, evaluated, packaged, and shipped literally thousands of tons of medical equipment and supplies to under-equipped and increasingly needy medical facilities in over 70 nations worldwide. And they have done it all at no cost to those facilities, to these people, and hundreds of thousands like them. Miracle is spelled IMEC. Here's how this unique organization works. First, recognized sponsors or shepherding organizations, such as Rotary International, Lions Clubs, and others, present their project to IMEC to fill the needs of doctors and nurses in developing countries, desperate for the medical equipment and technology needed to preserve and promote the health care of their patients. Next, the IMEC staff reviews each request to ensure it meets certain minimum requirements. Today's building project is for an advanced pediatric care suite destined for a hospital located in Kenya, Africa. The equipment and supplies are first assembled, complete with a stretcher, wheelchair, aerosol tent, vital signs monitor, nebulizer, and other similar items, and then packaged on a skid and wrapped in plastic to keep it clean and allow for easy storage and transport. Some suites even include carefully prepared and packaged linen and supplies. In a few weeks, doctors and nurses in a rural hospital on the other side of the world will receive those items you just saw prepared, and with them, they will be better able to treat the children whose lives have been entrusted to them. And it all started with one man, this man, Tom Keefe, who, with the support of his family, risked everything they had to turn his dream of helping those trained to help others into a worldwide reality. Tom Keefe is a former hospital administrator with over 20 years of experience to his credit. It was while serving as an administrator that IMEC was conceived.
In my 20th year as a hospital administrator, I was asked to participate in a project in an impoverished hospital on the other side of the earth. On my return, I realized how blessed we were to have everything that we had here in healthcare, and how little most of the rest of the world had. It seemed imperative to me to do something about that. So beginning in my garage, we started to collect equipment from hospitals and prepare it for shipment overseas. This is done by working together with hospitals, long-term care facilities, medical offices, and medical suppliers to provide us with all the equipment and supplies that we need, all of the surplus, all that's left over, that's no longer in need in our country. What we have come to believe is that just with our excess, what is left over, we can actually shape the way healthcare is delivered to the poor.
Once the donated equipment has arrived at IMEC's warehouse, it's first sorted, then cleaned, and then tested to see if it operates according to required specifications. If needed, the equipment is then repaired by skilled technicians. Technicians such as this man, Dr. Jim Beatty, a retired pathologist and IMEC volunteer.
I volunteer my time here at IMEC because I feel that the work is very important. It's important not only to the patients who will receive benefit from the use of this equipment, but also to the physicians who, without IMEC, would not have the opportunity to treat their patients effectively.
Appreciate your interest. Thanks for calling. Bye. My father started IMEC with hope and a dream. Hope that hospital administrators, like him, would not only see the financial and environmental benefits of sending us their replaced and recycled equipment, but also the moral and spiritual benefits of using their discards to help those in need around the world. His dream was for people to volunteer their time and sweat to clean, inspect, repair, package, load, and ship life-saving equipment to those who will put it to the best possible.
In an ever-expanding facility on the outskirts of Boston, sweat, tears, inspiration, and hope are transforming discarded medical accessories and surplus life-saving equipment into life-altering gifts. If you ever wonder whether miracles still exist in 21st century America, you need only to look into the faces of those who receive them and into the eyes of those who give them. Be a part of the dream. We urge you to contact IMEC at 978-557-5510 or visit their website at www.imecamerica.org. Please join us in joining them to help those trained to help others.